Good afternoon. I am Dr. Raghava Dutt, Director and Chief of Spine Surgery at Udai Omni Hospital. And today I want to interact with you on a very important topic, that is scoliosis. As you are aware, perhaps scoliosis means it's a deformity of the spine. So most of our spine, when you look from the front, is straight. Whereas when we look at a person from the side, the neck goes inwards, the upper back goes outwards, and the lower back goes inwards, like that. So it has these undulating curves in the spine when you look from the side. Whereas when we look from the front, spine is straight. Why do we need this straight spine? Because our head should be balanced on the pelvis when we walk, when we sit, when we run. So this balance is very critical for human gait and for the work that we do and all other activities that we perform in our day-to-day lives. So what is scoliosis? Scoliosis is a bend in the spine. So we don't have exact details of the number of patients suffering from scoliosis in our country, but roughly about 2 to 3% of population, 2 to 3 per thousand of population, I should say, suffer from this problem. So these patients have a bend in the spine, and most of this bend in the spine takes place when they are children. That means these deformities are very common in children. Some deformities take place when the child is in the mother's womb, what we call congenital deformities. And there are some deformities in the spine or bend in the spine that takes place when they are between the 4 to 6 years of age. Sometimes there are deformities that develop between, say, 9 to 11 years of age. So these are all scoliotic deformities. And these deformities are not just a two-dimensional deformities. They're actually a twist in the spine. The spine twists, and then you get a rotation of the whole spine. So that is what is scoliosis. It is not just a simple bend of the spine. This is one aspect. There's another also called kyphosis. Kyphosis means when you look at a person from the side, the person is bent. That means, like you can see, for example, old people, they're bent forwards, and their spine being having a nice cervical forward curvature, thoracic spine, backward curvature, to lower lumbar spine, forward curvature, it becomes rounded. So they're all bent forwards, and sometimes they walk with a stick or they walk what we call with a stoop. So this is what we call kyphosis. And this very well can happen in children. So, and other times we can have a mix of these two, what we call kyphoscoliosis. That means they not only have a bend in the spine from the front, not only do they have a twist in the spine, they also have a backward bend of the spine. This is a more complex situation. A lot of these scoliosis or kyphosis can be idiopathic. What is idiopathic? Idiopathic means we don't know the exact cause. Is it because of some of the secretions in the brain causing this problem? There was a lot of research on some of the hormones that are secreted in the brain, for example, melatonin. There is also sometimes changes in the nervous system that could cause this problem. Sometimes the muscles, for example, if the right side muscles are stronger than the left side, the spine tends to get pulled to that side. So muscle imbalances, lots of chemical imbalances, all these have been, are areas of research. In the world, we have a scoliosis research society, and every association, including our own Indian Association of Spine Surgeons of India, is doing a lot of work in finding out what causes this idiopathic scoliosis or scoliosis of unknown cause. Same way, for example, there's a kyphosis, and in this, there's a condition called Scheuermann's kyphosis, where the bones, instead of being square, they're slightly wedged. When they're slightly wedged, there's a bend in the spine. So when three bones, instead of being straight like this, if they are bent like that, the spine gets curved. These are somewhat rare conditions. Most idiopathic scoliosis or scoliosis that doesn't is not of unknown origin is easily treatable if diagnosed early. The other variety is the much more tougher scoliosis, what we call congenital scoliosis or neuromuscular scoliosis, etc. Now, neuromuscular scoliosis, for example, you must have heard about polio. Fortunately, it is now very rare in our country and mostly eradicated in lots of majority of the countries of the world. Now, this because of polio being affecting the muscles of the legs and hands, you must have seen some of the old polio victims. It can affect the spine also. When that happens, you get a round curvature of the spine, what we call the neuromuscular scoliosis. There are lots of conditions. For example, when a baby is in the mother's womb at the time of delivery, if the oxygen supply to the brain is not okay, is not optimal, then the brain suffers from hypoxia or lack of oxygen. That causes a slight brain damage, and that itself can lead to imbalance in the muscles, and that would lead to what we call neuromuscular scoliosis, secondary to cerebral palsy. Like that, there are lots of conditions that can cause this problem. There are genetic issues as well. In 10% of patients, if there are genetic anomalies, then that can lead to the malformation of the spine. Suppose if the vertebrae are not formed properly, what we call hemivertebrae or half vertebrae or one-third vertebrae, if it doesn't form fully, or if it forms also, if it is defective, then you get bend in the spine. These are much more complicated and need a lot of expertise to deal with these deformities. So sometimes, as I said, it can happen in the mother's womb, and these sometimes they can happen after birth, what we call developmental deformities, and sometimes, as I said, without a known cause, what we call juvenile scoliosis between the ages of 4 and 6. So once you observe deformity, you need to go to scoliosis surgeons. So how do you observe this deformity? How can you know whether your child has scoliosis or not? Today, I'm restricting my talk to children's deformities. I'm not going into scoliosis into adults, which is also very common due to degeneration of the spine. So that is a different entity, and we will discuss subsequently in my future talks. So, how do you know that your child has scoliosis? Today, in every major hospital, we have radiologists who, with an ultrasound, can diagnose when the child is in the mother's womb whether the child has a spinal deformity. It is not difficult at all. Unfortunately, these cannot be diagnosed by your obstetricians. Obstetricians are more concerned about the type, how the baby is lying in the mother's womb, what type of delivery will that be, what is the size of the head, all these things. Will she require a cesarean section? Will the mother, will the baby require, will be okay with a normal delivery? Is this a breech delivery or a shoulder delivery? All these things are the concerns for an obstetrician. Whereas for a this cannot be diagnosed by obstetricians. Sometimes, if the deformity is very severe, then they can identify it. But the best person to identify these deformities are neonatal specialist radiologists. There are radiologists today in Hyderabad and in major cities and towns who can do an ultrasound and tell whether the baby has a spinal deformity. So we can what we call intrauterine diagnosis of these deformities. So we can actually make a diagnosis. And once the child is born, it is the responsibility of your pediatrician, your child specialist to examine the spine of these children. And if they find any anomaly, they should immediately refer to a scoliosis surgeon. Now, the next thing is when the child is born, there are grandparents, parents, relatives who will all be coming to see the child. So, if you observe any unusual bumps on the spine, when you give them a bath, when you give the baby a bath, then you must think of scoliosis and must be seen by a scoliosis surgeon. Sometimes, when the children grow, you can observe that one shoulder is higher than the other. So, that means there is a bend in the spine. Sometimes, when you give them a bath, you can find that they have a hump. So, these are some of the small early signs that you can easily observe in your children. So, I urge all young mothers to undress their children and see whether their spine is straight from the front and from the side, and asking the child to bend forwards completely and observing from behind. If there's any rib hump, if there's any inequality of the shoulders, or when the child stands like this, if there's any difference in the waist crease. For example, if you see the child from behind, if they have a waist crease, one at a higher level and one at a lower level, that means there is a deformity in the spine. If this is observed, then again you must consult a scoliosis surgeon. Sometimes there's a tuft of hair in the lower back. It's like a bunch of hair in children. If this happens, you must, again, that's a very important sign that you need to consult a spine surgeon and certainly be referred to a scoliosis surgeon. And again, if there are any other anomalies, if there's a history of what we call neurofibromatosis, lots of lumps in the parents, one or the other, if there is a history of spinal deformity in the family from the parent side, from the father's side or from the mother's side, you must be alert to some of these children getting these spinal deformities and then getting evaluated by physicians, your pediatricians. Sometimes when you take your children to a pediatrician for cough and cold, they may observe that there's a deformity. Sometimes when they do a chest x-ray, they may observe a deformity in their spine. Now, I've been talking to you repeatedly about a scoliosis surgeon. Please remember, spine surgeons are no scoliosis surgeons. Not at all. This is a different specialty. It is a subspecialty of spine surgery. So people who are doing disc surgeries or other trauma surgeries or infection surgeries of spine are not scoliosis surgeons. There are a few of them in every city. So wherever you are, whichever city you belong to, find out who is the expert who is routinely doing scoliosis surgery. So only that person will give you a correct advice about how to treat this child that who has a deformity of the spine. So that is extremely important. This is one aspect. The second aspect is that our Association of Spine Surgeons of India, we have taken up this project of going to schools, what we call school screening program. So we go to schools now. We have started this a couple of years ago. Unfortunately, because of COVID, we have to postpone this program. Again, we have started pilot project. We have also started this in Hyderabad, and we will be shortly visiting some schools and examining these children and identifying these early deformities. Why should we identify them early? For example, if we identify the children, we do two things. If it is a small curve, let us say there is a bend of about 20 degrees or so, or less than 20 degrees, then we can easily give them plastic braces, and with the brace, we can correct a lot of these deformities. So that is the biggest advantage of correcting these deformities early. And the other important thing, sometimes even if they have severe deformities, we can prevent the progression of the deformity so that it's not progressing very rapidly by giving them braces, plastic braces. Again, giving these plastic braces are not the same as the braces that we give for back pain. These are made by special orthotists who have experience in bracing the spine of these children. And again, bracing is not just a two-dimensional thing. We have to correct the deformity in the brace in a three-dimensional pressure, giving pressure at the right areas on the spine and relieving the pressure on the other areas of the spine so that as they grow to their adulthood or to their adolescence, the crooked spine slowly becomes straight. So that is the advantage of diagnosing early. So observe your children, ask your pediatrician whether your child has any deformities in his or her spine at the first few visits, after they are born at 6 months, 1 year, etc. When you take these children to the pediatricians for routine checks or for vaccines, etc. So this is how, by referring and going to a spine specialist at an early stage, to a scoliosis specialist, a lot of these deformities can be corrected with braces. Most deformities, when they are diagnosed late, then obviously they would require surgery. There's a question here from Somali Bhattacharjee. What are the common types of scoliosis? As I said, there are different types of scoliosis. The most common type is the idiopathic scoliosis. These are benign curves. That means these are very easy curves to treat. The other types of scoliosis are due to congenital anomalies because of changes or alterations to the genes that are present in the mother and the father, or sometimes the Y chromosome of the male parent can get changes in their genome, in their structure, and that can lead to spinal cord anomalies in children, what we call spina bifida, and that can lead to deformities. The other types are due to neurological disorders that can also cause a lot of deformities or scoliosis in children. So birth defects, defects due to growth, unequal growth of the muscles, due to hormonal changes, due to sometimes childhood fractures can cause a deformity. If the fracture does not heal well, then if the bone is bent, then that can also lead to scoliosis. Again, we have a lot of tuberculosis in our country. So this TB, for example, can cause destruction of the children's vertebrae, and that can cause a kyphosis, that is a forward bend of the spine, or sometimes can cause scoliosis, that is sideward bend of the spine. So that is the same answer to Shweta Saha as well. The main cause, the idiopathic scoliosis, we don't know the cause. There's a multi-billion-dollar research going on. There are huge societies both in India and abroad. We are trying our best to understand what causes this problem, but the exact cause of idiopathic scoliosis is far from us understanding the cause for it. But once we identify scoliosis, there are a variety of ways with which we can treat them. For example, those due to birth defects, they are treated differently from idiopathic scoliosis. Now, can you correct scoliosis? That is a question from Binita Singh 100. Oh, yes. That scoliosis is easily correctable if they fall into the idiopathic varieties and if diagnosed early. There are three types of corrections. One, up to 10 degrees bend, we just observe them at 6 monthly intervals. If the bend is more than 10 degrees, up to 20 degrees or so, we correct them with braces. And as I told you just now, these braces require a lot of expertise. So we do special X-rays for these children. They are not the routine X-rays that you can get in the diagnostic centers. So we need full standing or X-rays. Sometimes we do X-rays sitting, and then we do bending X-rays. Sometimes we do what we call traction films. All these X-rays are studied. Then some of them we do ultrasound scans, especially those that are due to congenital anomalies, because from 8 to 18 to 30% of these children can have associated heart disease or kidney disease, so genitourinary anomalies. So an MRI is mandatory for these children, screening of the whole spine, and of course an ultrasound scan to rule out the genitourinary anomalies. And we refer them to pediatricians and cardiologists so that they rule out any holes in the heart, what we call ASDs and BSDs, septal defects, any other anomalies. Lots of congenital anomalies take place, valve anomalies, etc. in the heart. All this is checked by them. There's a question by Simran Pradhan. Are only children affected? Certainly not. Lots of adults get scoliosis, again due to infections, due to fractures that are not properly treated. And the most important cause in adults is due to arthritis of the spine. Just like you get arthritis of the knee, just like you get arthritis of the hip, you can also get severe arthritis of the spine. And because of this arthritis and wear and tear in the spine slowly bends, what we call degenerative scoliosis. Again, very common after the age of 45, 50, and certainly much more common in the 60s and 70s and beyond. So any adult or child can get affected. So starting from the child or the baby in the mother's womb, the fetus, to any age, our spine can get crooked or deformed, and that can happen at any age. Wanted to know if the scoliosis is genetic? Yeah. In a small percentage of patients, scoliosis is genetic. Genetic is different from hereditary. Please remember, hereditary means goes from father to mother to child and his children getting affected. This in scoliosis is extremely low. It can happen, but very, very low. So the hereditary forms, parents, children going to children, children transmitting to their children, is very low. Whereas genetic malformations due to changes in the genome structure of the human being, that can lead to scoliotic deformities. And overall, the incidence of genetic anomalies in these children is about 10% in the world. Can you live a normal life with scoliosis? Yes, you can. Some of these children require surgeries. Sometimes we put growth rods. That means exactly like you jack up a car. So we put a growth rod in the spine, and slowly with putting magnets outside, we jack up the spine. So if the spine is like this, for example, we put rods and slowly every 6 months we elongate them so that the crooked spine gradually and slowly becomes straight. This is what we call growth rod corrections. Sometimes we put braces and then correct the deformities. If it progresses to, let us say, just as an example, more than 40 degrees as a thumb rule, then we operate, we correct the deformity by putting screws and rods and correct the spinal deformity. This is a good question. Simran Pradhan, can you live a normal life with scoliosis? Yes, 100%. You can live normal life. If they're married, the children can have completely normal married life. They can have children, they can climb mountains, they can play games, they can play sports, they can do what every other person does. So early diagnosis is the key. That, and where required, if you do surgeries, then they give very good results. Now there's a question from Shrija Chakrabarti. I wanted to know if there are other health issues associated with scoliosis. As I said, for example, in adults, a degenerative scoliosis is also associated with degeneration of the knee joints. Most of these individuals are slightly less physically active. They can have osteoporosis or weakness of the bones. This is very common. So, lifestyle disorders, for example, diabetes, blood pressure, etc. A lot of these adult scoliotics are mostly into lead sedentary lifestyles. So you can have all the complications associated with sedentary lifestyles, and also in adulthood, you're subjected to various other comorbidities, as we call in medicine, other medical conditions that can be associated with scoliosis. In children with scoliosis, three things can happen. I just enumerated about the genitourinary anomalies. I also talked to you about the heart anomalies. Max, it can be up to 18 to 18% and above in these children. So that's what we check when these children are brought to us by their parents, etc. Now, the sometimes if the spinal cord is affected, suppose, as you all probably know, spinal cord is a single tube. Sometimes instead of being a single tube, you can have two tubes running parallelly, and there can be a bony bar between the two tubes, and that bar, the spinal cord can get stretched over that bar, and that can lead to paralysis or weakness of the legs. Sometimes there are conditions, anomalies, what we call tethered cord. That means the nerves get stuck to the surrounding vertebra, and as the child grows, there is a traction on the nerve that can cause weakness of the legs. That can lead to paralysis. So these are some of the issues, and this is the same the answer to Mr. Rahul Bila. How dangerous is scoliosis? It is not dangerous. For example, in children, if as you are probably are aware or perhaps not, most lung development takes place up to the age of 6. So the lung growth, max it goes up to 8, but most of the growth of the lung, human lung, is over by 6. So if you don't correct the deformities before 6 years of age, if the spine is bending, then one lung cavity is normal, the other lung cavity is small, because the spine is bending, and this where it is bending, that side, that one lung gets compressed, so that lung won't be developing. So they may have respiratory difficulties as well. So these are some of the issues with scoliosis if it is not corrected. So early diagnosis is very important. Mr. Arjun Nandakumar, how is scoliosis diagnosed? As I said just now, perhaps you can, I'm not too sure whether you can listen to it again on Facebook, but if you can just rewind and have a look on this, upload or whatever, and download, I should say. So we can diagnose scoliosis in the mother's womb today very easily. And there are some simple blood tests called alpha fetoprotein. These are some of the simple blood tests, very cheap blood tests, not at all costly, we do when the mother is pregnant. And neonatal radiologists can diagnose in the mother's womb. Every child, when they are born, should be seen by pediatricians. It is the responsibility of the pediatrician to diagnose scoliosis. It's also the mother and the father should feel the spine and see if there are any bump. One thing I forgot to tell you, if they have a very small neck, that means the neck, the hair at the back of the neck is very low. So normal children, if they have that much gap here, the hair grows right up to the top of the upper thoracic spine. So low hairline, or if there's a tuft of hair in the lower back, or if the shoulders are unequal, or when you give the baby a bath, if you find that there is a rib hump, these are some of the indicators of whether the child has a scoliosis or not. Harshita Agarwal, what are some of the methods to manage pain during scoliosis? First, you must consult your scoliosis surgeon because some of this pain cannot be treated without surgeries. So you must consult, you must be fully and thoroughly evaluated, both clinically as well as radiologically. Like in any pain management of the spine, if you are into sitting jobs, please get up. Don't sit. As I tell every day to lots of patients in my practice, please get up from your chairs. Don't sit in front of these laptops and computers hours end on. Every 20 minutes, you must get up. Don't put on weight. Weight is the biggest enemy today to human beings. Maintain ideal weight. Don't smoke. Smoking destroys human spine. Lots of doctors and lots of people do not know about this. Smoking causes early degeneration of the spine. So say no to smoking. In any form, tobacco is not good for health. Play games, play sports, do swimming, do yoga. Spend 1.5 hours on your body. And every human being today has enough time for sports. If you don't if you don't play, if you don't engage yourself in vigorous physical activity, you will suffer from back pain, scoliosis or no scoliosis. Purna Ambani, what are the treatment options for scoliosis? Lots of treatment options. We do a lot of surgeries for scoliosis, apart from braces that I talked about, apart from growth rods, what we call growth modulation techniques. Sometimes when the spine is bent, what we do surgeries on the convex side, sometimes by putting cables, sometimes by putting special staples, so that we arrest the growth on the convex side of the bend, hoping that slowly the concave side continues to grow. These are growth modulation technologies. So these are very complex surgeries. Sometimes we open the chest, go to the front of the spine, and in the same sitting, we go behind and do convex growth arrest procedures so that slowly the child grows. When the child becomes 14 or 15, they have a normal straight spine. Sometimes, if one vertebra out of many vertebrae, as you know, spine is not a single bone, it has multiple bones. It's like a bicycle chain. There are lots of links. If one link is damaged, we remove that or we excise that and then we correct the deformity in small children as early as 3 years, 4 years, 6 years. So the earlier we operate, the better the result. So we operate on these children. Once they come to 12 or 13 years of age, we put screws and hooks and rods and gently straighten the crooked spine with rods and screws. So these are various treatment options that we do. Sometimes, if the curve is very rigid, we get children with 80 degrees bend, 90 degrees bend, 100 degrees, 120 degrees. So these requires extremely complex operations, what we call spinal osteotomies. What we do is, in other words, we break the spine at multiple levels and slowly by doing selective osteotomies or breakage of the spine, we gently correct the deformity with using what we call spinal cord monitors. These are uh, these are just like as you must have seen in the movies or during COVID time, you must have seen in the on the channels where we check your ECG when the patient is getting operated or in the ICUs. Same way, we have technology today available in a lot of hospitals in India where we use this monitoring. That means when we are correcting the deformity, there are nerves inside. These nerves are extremely delicate. They're extremely soft. So in order to prevent any damage and prevent risk of paralysis, we continuously monitor your spinal cord activity while we're operating on your spines, on the patient's spines. So that is one of the ways of preventing any neurological damage during spine surgery. That is what we do during surgeries. Purna Ambani, is scoliosis considered a disability in India? Well, that is a very broad statement. Is it considered a disability? Depends on the type of scoliosis. So, what medical uh, professional think about disability is different from what people think or attribute a disability. Scoliosis is certainly a huge psychological, causes tremendous psychological damage to the children and to the parents. If the spine is crooked, not treated, the child cannot assimilate into the normal society. So it's extremely important that they don't suffer from this psychological trauma, and that itself is a big disability. So, untreated scoliosis with severe deformities, they have a lot of pain, they are bent to one side, they have respiratory difficulties. So, that again is a big problem. So, the straight answer is yes and no. So, most times, corrected early, treated early, with or without surgeries, they give extremely good results, and many people can avoid being disabled with spinal deformities. I think we are nearing the end of this session. I thank you for your participation, and I hope I have answered some of the simple doubts that you may have about this complex spinal deformity of scoliosis and kyphosis. Good day. Good afternoon.